Hello, everyone, and welcome. I'm pleased today to be joined by Dr. Jorge Chahla. He's the ACL knee surgeon expert. Thanks for being with us, Dr.
Thank you very
Chahla.
much.
Please, would you please introduce yourself?
I'm Jorge Chahla. I'm an orthopedic surgeon. I work in Rush University in Chicago, Illinois. I do mostly knee, but I do some hip and shoulder as well. Within the knee world, I don't do any arthroplasty, so I do about 350 ACLs a year. And I love the surgery. I think that it's a phenomenal thing to get people back in track.
Oh, nice, thank you. I saw your ACL BTB, and let's start with one question. Why would you choose the BTB as your graft of choice? As you know now that we have different graft choices. For me, I go quads only for primary revision, and you go BTB. Is there any specific reason for that?
I think there's multiple. I don't think we had a session today that was very good, which basically enlightened the fact that there's a graft option for each person, right? So I think it's a conjoint decision between the surgeon and the patient. I like BTB for multiple reasons. One is it's a reliable graft. You can get as much collagen as you want. You have bone-to-bone fixation, and with that you have a screw fixation that makes it very cheap. It's a very cheap, inexpensive procedure. The second thing is, if you look at the data, it's been the gold standard for over 30 years, and the reason for that is that when you look at retear rates and big registry data, so if you look at the Danish registry, the Norwegian registry, they all show more or less the same thing, which with some caveats is about double what it is for quads, right? So there's some things that we can potentially look into the specifics of those studies, but certainly at a bare minimum I would say it's equivalent. And then I've learned a lot from Charlie Brown in how to address the soft tissues, Bone-Patellar patella and the tibia, and that has minimized the anterior knee pain. So for us, it's a absolutely phenomenal graft. We've had great outcomes and people seem to be happy.
That's a great point. The anterior knee pain, one of the withdrawals for the BTB, especially in our region, in the Middle East. But I think yesterday you mentioned a couple of points, just how to avoid or minimize the risk of anterior knee pain. If you can, please mention it again.
Yeah, I think it's important to be very meticulous with the dissection first, so making sure you take a good tendon and paratenon. If the paratenon is well preserved, you can actually close it and keep the graft. It's important to harvest as much bone graft as you can. So what I do is on the tibial plug, I actually go fairly deep so that I can get good bone graft. And also when reaming the tunnels for the tibial side, but you can also do it on the femoral side, you can collect all that bone dust, which is very good to fill in the defect of the patella. So once you've done that and you close the paratenon, you have a very nice closure. And then you approximate the borders of the patellar tendon. That makes for a very nice closure. It's very well organized in layers, and that actually prevents anterior knee pain to a greater extent. We just did a study where our incidence of anterior knee pain was about 4%, so it's very low.
That's excellent. For young surgeons, they are starting with BTB. What's your single advice for these guys?
So I had a chairman in Argentina that used to say, if you have mini experience, you should do maxi incisions. And I think that's a great place to be, right? When you don't have a lot of experience, you want to see very well. A lot of the mistakes that happen in surgery is because they don't see very well, they can't understand where the center of the tendon is, they end up harvesting too much or too little tendon. So I think having a good incision that allows you to see a good meticulous dissection, taking your time to actually be very careful and meticulous, you have to become good before you become fast. So I think taking the time to do a good job is important.
Yeah, totally agree with you. Thank you, Jorge, for being with us today, and see you soon.
Thank you very much.